everybody, and welcome back to the Honest Providers Podcast. This is Dalton Young with IOP Link and Protect Advocacy. And today I'm with my good friend Joe Feldman at Cover My Mental Health. He's the president and founder. And welcome.
Thanks for having me, Dalton. Looking forward to our conversation.
Absolutely. So this podcast is really an opportunity for us to discuss ethical care, to discuss what being an honest provider would mean. But obviously, you may not be a provider, right? You're in the advocacy space, and we don't just only talk to providers, but also advocates, families, and patients, people who have experienced care and everything surrounding care. And at Cover My Mental Health, I know y'all do some interesting things that surround the healthcare space. So I really want to bring awareness to what y'all do. And so I'll let you take the reins. Who are you, and kind of what led you into this advocacy work around mental health, disability recovery, etc.?
Great. So Cover My Mental Health has been around for almost 2 years, and we focus on supporting patients, families, and clinicians with resources to overcome insurance obstacles to mental health and substance use disorder care. So we know that it can be a challenge to find a clinician who has the right expertise and has appointments available and is somewhere nearby. And we know that insurance companies too often raise obstacles to care, like your care is not medically necessary, or maybe you should try to take 2 aspirin and call me in the morning instead of taking a medication that a clinician has determined may be right. So we provide a range of free resources, all based on common sense and all supported by encouragement that you don't have to take no for an answer. I got involved in advocacy in a way that won't surprise you or any of your listeners. Years ago, one of our kiddos needed care more than what we were able to provide at home. And so on the recommendation of a clinician, we found a residential program that was suited. And very shortly after the program got started, our insurance company said, we're not going to pay for this because it's not medically necessary. And so we knew they were wrong. And all the clinicians involved knew that the insurance company was wrong. We used our savings to have our kiddos stay in the program and to deal with the insurance company later, which we did. We filed a federal lawsuit against them ultimately, which we won, and then they paid what they should have paid in the first place. That's what pushed me into advocacy, because what I learned is litigation is a terrible way to enforce your rights to the health insurance that you bought. And it turns out there are many, many steps that can be taken, many of which I did not know about at the time, that can help patients, families, and clinicians to overcome these obstacles.
Definitely. And I've spent a good bit of time, prior to we spoke previously, but looking at your website and seeing what you do. For anybody who's curious, your website's is it covermymentalhealth.com or .org?
.org.
.org. So covermymentalhealth.org. If you check out the website, you will see that there's a ton of resources, and Joe spends a good bit of time also explaining their situation and how insurance has impacted that care. And a lot of people that are, experiencing, whether it's crisis trauma, whatever the situation, you feel like a number sometimes, and you're trying to get the help you need, and sometimes you can't get the help you need because it's not deemed medically necessary, right? And those two words can disrupt your entire life of your life or someone you know and love. And the resources that you have on your website is super helpful and really helps advocate and show you what your options are. I know with Protect Advocacy, what we do with protecting rights of those experiencing crisis and trauma, there's a lot of people who need resources like yours, and they go really well with the resources we provide, because we're mostly focused on rights. And I bring that up because you spoke about rights, and knowing your rights is key to getting proper health care, especially with today's legislature and, a lot of the challenges that are facing the healthcare industry. So tying what your resources cover primarily, especially around insurance, combined with what we have going on, the two really go hand in hand. And I'm super excited for essentially a partnership to help cross collaborate what you're doing, because you're changing lives. And, you experienced it first, because my next question was going to be, what have you seen or lived? And you just broke it down, that medically necessary for family and you're not the first person that I've seen or know that has went through and spent their life savings trying to get help for someone they love because insurance won't cover it. It's not medically necessary. And you're battling the system. And unfortunately, going through that legislature, fighting it legally it's difficult. And no family should have to face that. We should be able to get the care we need. But unfortunately, that's how it is. So with that said, how do you support people differently than the systems or institution they're often up against, right? You're saying you advocate, but what do you do differently that separates you from, because there's federal resources and we talk a lot about that on our website, federal resources and state resources, but sometimes they're not good enough. How does Cover My Mental Health differ?
So we are focused on, first and foremost, providing encouragement. So I can't say that enough. Encouragement that you don't have to take no for an answer. And we approach the resources that are available with the idea that if you're not encouraged, you're just not going to bother, because it's going to seem like one more hard project that you just don't need.
Right.
We focus on resources that are usable today. So if you were to look in your health insurance policy, somewhere in there you'll find probably one action that is offered in the event of some kind of a dispute. They'll say, if you have a dispute with us, file a formal appeal. Well, that's a legal process. It's a time-consuming process. And what they don't specifically tell you, but is the case, is you have to follow the process exactly. You have to provide evidence in a very particular way, and it's going to take more time than you can imagine, probably, to get to an answer. What insurance companies don't tell you is that there are many steps that you can take literally today that can make a difference. So one of the most significant resources that we offer is a medical necessity letter template. So a template is something that we offer to be downloaded in Word from our website and shared with a clinician. And the document basically provides a way for a clinician to put in writing the kind of conversation that they would have with an insurance company to explain what's going on. So they introduce themselves. Hi, I'm a clinician working in this particular area. This is where I was trained. This is the care that I've been providing to this patient, Joe. And based on their needs and my assessment of generally accepted standards, this is the care that is appropriate. This is the care that is medically necessary. And then it's on letterhead and it's signed. And the idea of a template is to make it as easy as possible for a clinician to provide that document to their insurance company.
Right.
So it's a way to put a marker down that says, if you're going to deny the care as not medically necessary, we want to even the playing field by having the clinician document that, in fact, the care is appropriate and medically necessary. Our website has a handful of success stories where clinicians have used this template to document their patient's care, and the insurance company has backed down and covered the care after receiving the letter. So we know these letters work.
Awesome. No, that's helpful, because so many people, they get stuck in a situation, and it's such an uphill battle, especially as a parent, for example, or family member. You're trying to help, and it's almost like you're getting stonewalled, basically, right? You can't get past it, and then they're like, well, follow this process, and these processes take weeks, take months, sometimes take years, and the care cannot wait. You cannot wait on the care sometimes because it's causing permanent damage, right?
I call it the "we will wait you out" strategy.
Right, and they have
more time
and the fund. They have the resources and the funding and the legislature to actually do it. I don't believe that all healthcare industries are. I don't believe that intent is malicious by nature. However, it doesn't mean malicious behaviors don't exist. And for every family that's helped, there's another family that's not helped. So it's unfortunately it's not 100%. I don't know, not 100% accurate, but it's not 100% able to help everybody 100% of the time, right? There's a lot of gaps and a lot of holes in insurance, and we see this a lot with the facilities that we work with at IOP Link, is that a lot of our facilities and our clinicians, they face a lot of challenges with patients who are falling in these gaps and cracks, especially anything that requires like pre-authorization or something like that, right? But even just, and it makes, patients won't help, whether it's a long-term care situation, whether it's a recovery, whatever it is, and they're unable to get the help they need because they become a number, and they feel like a number, and they get discouraged, and oftentimes it creates more problems, and the time causes them to regress in their recovery or their treatment, whatever they're going through, right? So
right. Yeah, I mean, the way I think about your organization, so you've right in your name, IOP Link, you're talking about, you're opening the door to different levels of care. So outpatient, intensive outpatient, partial hospitalization, residential, inpatient. So clinicians, just like patients, want to use the lowest level of care that's going to get the job done for their patient. And that could change over time. And insurance companies also want to use the lowest level of care that is appropriate. And so you could say there's a strong bias from everyone concerned to use lower levels of care. That's not necessarily a bad thing. It's a bad thing when an insurance company says, we think this patient should be treated strictly on an outpatient basis. And the clinician says, based on my experience, my training, and application of generally accepted standards, intensive outpatient or partial hospitalization, whatever it might be, is the appropriate level of care. Mm-hmm. That's the sort of information that is documented in a medical necessity letter, and in a way that the clinician asserts to be the case. It's really an important resource. By the way, we recommend that clinicians provide medical necessity letters when a denial has been received or when a denial is lurking. And clinicians know very well from their experience when a denial might be lurking and when it may be helpful to have a medical necessity letter put on file with the insurance company. For example, when there's a change in level of care, that's a perfect time to use our template, document the change in level of care, and not advise or request that the insurance company do anything about it. We're just putting it on record. This is the level of care that's appropriate for this patient.
Absolutely. And I think any family member, clinician, family member, patient, anyone watching this should go get the templates from Cover My Mental Health and take those templates and just have them on hand for when those situations arise. That way, again, we talk about it a lot as well, as having clear documentation and having everything on file. Not that you hope to never need it, but if you need it, it's great to have it, and to focus on being organized, because a lot of facilities, a lot of clinicians are experiencing burnout, and a lot of facilities are understaffed and overworked. And as much as many people want to focus on helping as much as they can, they're only people, and we're all people at the end of the day. So you are being an advocate for yourself or those you love is a huge asset, because it allows you more of what's going on, and you can create a better trail or record trail or anything, whether this is for legal, medical, etc. Right? So document everything and stay as organized as possible.
Yeah, two additional suggestions that we offer on our website, and I think I mentioned everything on our website is free. We have a whole section of resources for clinicians that go a little bit deeper into medical necessity letters, preparing for a peer-to-peer review call, which clinicians often have to have with an insurance company. And what we've learned is there's no systematic training for that really important moment of advocacy for their patient. We are filling the gap there with some very robust guidance. So you talk about documentation. We certainly encourage anyone who's interacting with an insurance company to just keep notes. Write down who you talked to, what their ID number is. I've done this many, many times, and sometimes they won't provide the ID number right away. So I just say, well, I'll wait because I know that you will. So
Right.
as soon as you do, we can get on with the conversation. It's about being just sure of yourself. You don't have to be angry or upset. That's probably, in fact, not useful.
Right. Yeah, we talk about that a lot too. Don't get, even though it's a very emotional situation, don't react emotionally, because that composure can be used against you if you, it
It's
can
just
be
not necessary. I mean, it's just not necessary. So document what was the discussion. Don't have clinical conversations with the insurance company. That's not a patient's or a parent's role. Certainly a clinician can and should do that. To write down who said that they were going to have some follow-up steps, either on the insurance company side or on your own side, and keep those notes. The other step that we talk about, and this is one that turns out to be way more valuable than I ever imagined. Every insurance company has a document you can find on their website where you can authorize someone to basically be on your team. So it's sort of like a power of attorney where, say I've got a family member in crisis and I'm dealing with all this, and we might say, geez, these resources that cover my mental health are really great, but I just don't have any bandwidth to deal with this. And so I say, Dalton, you're my friend. Would you help me with this? I want to sign you on as an authorized representative of me to work alongside me, to be a member of my team. And when I've suggested this to be on the top of the list for clinicians, the reaction I've gotten is just unbelievably positive. They're like, oh my gosh, of course they can do that. It never crossed my mind to think about this as a step that might be helpful.
Right.
Might be helpful to add someone else to the team when you're just out of bandwidth.
Definitely. Is that like a medical surrogacy type form?
So they may have different names. They probably wouldn't have medical surrogacy, but it could have authorized representative form,
Okay.
or something, some similar name like that.
Basically, someone who you're releasing, they have access to they can consult with you on medical records and stuff. I know in Florida, for example, there's one called a supported decision maker, right? Which is something that can, again, it's a state specific, but there's different things where people can request records and be involved with your care and help you make decisions.
Right. So obviously you wouldn't want to take that decision casually about who's going to help you. But if you have a friend or a family member or a neighbor who you trust to just make those extra phone calls, they're not making medical decisions in the same way that you're not making a medical decision so much. If you're the patient or the family member, you're there to interact with the insurance company to say, I'm calling to follow up on a call from a week ago where the insurance company rep, whose name was Joe, said that I was going to get the following document by email and we haven't gotten it yet. Or we sent a medical necessity letter in and we're waiting for the confirmation. Or we filed a formal complaint to the insurance company and we haven't heard back by the deadline and we're just following up. Somebody who can make that call and ask the questions.
Yeah. And you said something a minute ago that really made me think about, you said that a lot of times, or not, basically, you don't have to, if you're not a clinician, a lot of family members, or, if you get asked what your opinion is, it's not that your opinion doesn't matter, but a lot of times you don't need to speak. And a lot of times legally that can be, we see that from on the protect advocacy side, right? As far as your rights go, a lot of times insurance or providers or lawyers want to ask what you think and your opinion, when in reality it can be spun against you, since like you said, you're not a clinician, and B, it's really not your space to be speaking about it. They need someone that's licensed and trained to do that. So when you take your opinion, it can be used, and I've seen it get used against people because
when our kiddo was in this residential program, I was on the phone with our insurance company and they said, so by the way, how's your kid doing? And I said, well, they're in the right program. No, but like on a scale from 1 to 10. I said, well, I guess on a scale from 1 to 10, it would be 1 because obviously this is an extreme case and she's in a program that's very different from anything. Well, what would you, is it getting better?
Right.
I said, we're not here to have a clinical conversation, period. So let's just don't.
It's similar to like I compare this to like a workers' comp claim, right? Workers' comp is going to want to ask the family and friends, and they're like, how are you? Or what's going on, as opposed to going, through the proper channels, because they're trying to get any information they can to not potentially cover.
They used to say that you'd go to the amusement park and somebody would fall down,
Yeah.
and the staff would run over and say, "Are you okay? Are you okay?" And of course, the instinct is to say, "Yeah, I'm fine."
Right.
And it's like, well, maybe you are fine, and maybe you're not. And if you're not, the last thing you want to run into is somebody saying, "Well, we would have done more. We would have called an ambulance. We would have, gotten medical care, but we asked, and they said they were fine."
Yeah.
So the answer to a question like that is, I don't know.
Yeah. I wouldn't say right to remain silent, but yeah, like, I don't know, get someone who's qualified to make those evaluations versus making, because like you're right, naturally we would say like, oh, I'm fine, I'll be okay. But you're affecting your own level of care. And again, those statements do get used, even though they shouldn't, they will get used, because those are the initial, they use those initial reactions to make initial decisions, and that can affect the long-term goal. So
exactly, that's not about ill intent necessarily.
Right.
It's just about protect yourself.
Absolutely. So I know I've had you for a while. A couple of things, looking back at your advocacy journey so far, what moment reminds you of why this work matters?
So I was presenting at a conference last summer, the International OCD Foundation conference, and then talked about some of our resources and some of our successes helping people. And someone came up to me afterwards and they said, "I wish I had heard you 5 years ago. That's what I really it would have been really great." And I said, "Well, I wish I had been running Cover My Mental Health 5 years ago too. But here's the thing, you can spread the word so that down the road, somebody else will have gotten the message, and then they won't have to say what you just did." So to me, every time I talk to someone, every time I have an opportunity to have a conversation like we're having today, there's people who are going to hear about these resources and use them and get the care covered that is needed, and it's going to save lives.
Absolutely. The phrase I once heard was, and you may have heard this, the best time to plant a tree was 30 years ago, but the second best time to plant it's today. So
it's exactly right.
So with that said, Joe, I appreciate you taking time out of your day to be on this podcast and share your experiences and your resources, because you're changing lives already, and you're going to continue to change more lives. So thanks again for being here.
Absolutely. Thank you. And folks can visit our website at covermymentalhealth.org. And if you have any questions, you can email me at joe@covermymentalhealth.com.
Okay, awesome. Where can they find you on social media?
We're on LinkedIn, and we're on Instagram and Facebook.
Okay, they just search Joe Feldman or Cover My Mental Health, or both?
Search Cover My Mental Health.
Awesome. All right, Joe, I appreciate everything, and I'm sure we'll be chatting very soon. If anybody else has any questions, be sure to reach out to Joe. Thanks again.
Thanks, Dalton. Take good care.